Hello, everyone, and welcome back to the Nurse on the Go podcast. In today's episode, I'm going to dive into what I wish I knew before starting nursing school. This is going to be divided into a part 1 and a part 2 that I'll be posting next week. So for today's episode, I'm going to be discussing the 5 things I wish I knew before starting nursing school. This episode is not just for students who are expecting to go into the nursing program this fall, but it's for anyone who's considering going into it, if they're doing prereqs, or if they are just in high school or middle school and really are interested in going into nursing school. So I really want to prepare you guys mentally and physically to know what you're getting yourself into and what I personally wish I knew before getting into the nursing school program. So without further ado, let's get into it. The first thing I wish I knew before going into nursing school was to go in with an open mind. So before going into nursing school, I really didn't know what to expect or what specialty I wanted to go into, but I know from my fellow peers and other people in the program, they really had something in mind. They were like, I'm set, I'm going to do labor and delivery. That's what I'm going to invest all my time into. Oh, I see myself being an ICU nurse, so I can't wait for that clinical. I'm going to give it all for that class and that clinical. But realistically, not many people go into the specialty they expected to go into during their first year of nursing school. So what happens is in nursing school, you're able to join into different clinicals and everyone gets the experience of experiencing different clinical specialties such as labor and delivery, ICU, pediatrics, mental health. You're going to go into all those clinicals, and what that does is it gives you the opportunity to see what it's like in an actual clinical setting instead of just learning it in a class. So by doing that, you may find things that you're really interested during that clinical. So let's just say I was really into pediatrics going into nursing school, but I went into mental health and I really fell in love for what mental health nurses did during their day, and I really fell in love with the patients and just the experience as a whole. So by going in with an open mind, you're allowing yourself to experience all these different clinical placements. And what happens when you come into your 4th year when you're able to pick a consolidation, which is a practicum of any one of your choosings that you can apply to do for your 4th year of nursing school. And what that does is allows you to go into a specialty that you want to. So overall, I want you guys to go into nursing school with an open mind. If you're really interested in a specialty, that's okay. Invest your time, really enjoy it, give it your all. But I also want you to give it your all for all the other clinical specialties, because if not, you may go into it with a biases into all the different other clinical settings and be like, oh, I'm not really a fan of ICU, so I'm not going to care to memorize all these medications, or I'm not going to care to memorize all these clinical examinations, vitals, etc., that you would expect to see in someone who's an ICU patient. But what that does is it just closes you off, and it gives this preconceived notion to yourself that you shouldn't give your all. But in reality, you should, because at the end of the day, you never know what clinical path you might go to, and you never know what nurse you'll be able to do. So go into it with an open mind, and I promise you won't regret it. The second thing I wish I knew before starting nursing school was when I'm studying for an exam, you definitely don't want to just memorize everything, because what that can lead to is just black and white memorization. And what I mean by that is if you expect to go into an exam and see a question such as, what are the side effects of so-and-so medication? And okay, you will see some of those questions on an exam that are just black and white memorization. But in nursing school, you will definitely have a majority of your questions being nursing school based questions, meaning that you're going to have 4 options or however many options you'll have, and they'll all seem like the right answer. But what you have to do is use your clinical skills, your understanding of the actual content that you are studying to be able to answer that question. So you have to know what you're studying and not just memorize it. Along with that, the reason I'd say to not memorize is not just for tests, but as well for clinical situations where you have to think fast or know what to do in a certain scenario. And if you don't know what to do, or you just know the normal and abnormal symptoms of something, it may not be enough to be able to clinically understand what is going on in a certain scenario. Just keep in mind that you don't need to memorize everything, but you want to be able to understand the content so that you're able to apply it. And the third thing I wish I knew before starting nursing school was to know your learning style. If you're coming into nursing school straight out of high school, you may have a preliminary understanding of what your learning style is or what style you did best to get the best grades. So what I recommend you do is to go in with a preconceived notion of what kind of learning style you are. If you don't know what learning style you are before going into nursing school, do your research, watch YouTube videos, and you may get a better understanding of what you prefer. So there's definitely the visual learners who enjoy seeing stuff, videos, hearing someone in person explain something, or you can be an auditory learner who does really well listening and hearing what people are saying, and that's how they understand best. Or you can be a reader/writer learner who has to rewrite something or has to continuously read textbooks to better understand, or you can just be a kinesthetic who's more hands-on. So there's many different learning styles. And what I want you to do is really understand which one you are, because that will definitely save you so much time in the process. And you don't want to waste too much of your time in nursing school discovering what kind of learner you are when you can already have that done and figured out before going into nursing school, so that you can save so much time and you're better off with your grades, knowing what kind of learner that you are and how you take the information beginning from class to when you apply studying and doing exams. The fourth thing I wish I knew before starting nursing school was that not all quote unquote required textbooks that your professors may say are required for the class are actually required. So what I recommend for this is to wait until your first class. But if you know someone who's in a previous year who's already done the program and has already done the same class, you can message them. If you have a same group on a Facebook site where they have the same program of students from all different years, you can ask, do we need this book for this class? But I highly recommend, for a 100% accuracy of what books and textbooks you may need, I recommend you wait for the first day of class. Or if you know who your professor is going to be, just send them an email, because there may be that slight chance that for that year you don't need the textbook, or that they want a different edition of the textbook that is not the same for previous years. Along with that, you will be saving a ton of money because textbooks are not cheap. So by just knowing this before you spend lots of money on those textbooks, you'll be saving a lot. The fifth thing I wish I knew before starting nursing school was how to practice self-care. So going into nursing school, I really didn't know what burnout was or how stressed I could get during school. So I really went into it with an open mind. I heard nursing school was hard, but I'll get through it. But I recommend for you guys is to know when you're feeling stressed. Understand your body mentally, emotionally, physically, to know what kind of signs and symptoms you may have when you're feeling stressed. So if you have an exam coming up and you're super nervous and anxious to do that exam, I recommend you maybe do some things, some self-care activities that maybe make you more relaxed. If that's cooking or going on a walk, do little things like that so you're keeping your self-care maintained as you are feeling stressed, and it'll bring down your nerves a lot. Because in nursing school, I noticed that I would go weeks or just months with no self-care and just test after test after exam after exam. And what that made me do was just feel really anxious and nervous, and it led me to points where I really was burnt out and I really felt no motivation to continue studying. So by knowing your quote-unquote signs and symptoms before that even begun, you could be able to treat it with some self-care activities that you enjoy doing, if that's seeing your friends. So really keep that in mind going into nursing school. If you guys enjoyed this part 1 of things I wish I knew before starting nursing school, tune in next week to find out 5 more things that I wish I knew before starting nursing school. Thank you guys so much for tuning in to today's podcast. I hope to see you in my next. Don't forget to check out my Instagram at the Nurse on the Go podcast, where I post motivational posts as well as educational posts for all my nurses and nursing students. Thank you so much once again. Talk to you soon. The Nurse on the Go.